Well, thank you, Dr. Zollman, for coming in and having a little chat with us at the end of your talk today. You mentioned at the end people accessing their healing portal and how that can, different people can have different accesses. Would you like to sort of expand in your experience?
I mean, this is purely from my clinical experience that sometimes it feels like the sort of origin of the problem is at a very psychological level, or maybe a childhood experience levels. Other times it is just unhealthy patterns that they've fallen into. Other times it feels like there's an experience that they need to have that feels like it's waiting to come out of them. So I sometimes feel that just giving the system a little nudge on to the next stage in whatever way you can do. And I think sometimes a dramatic change, whatever that is, so it could be a relocation, it could be a new job, it could be a fairly sort of comprehensive dietary overhaul, can sometimes be what it takes. And often it's also, in my experience, a meeting with a complementary therapist who can actually make some sense of something in a different way than they'd had made before, but or the non-specific effects of a meeting that really made a difference to somebody. So that's what I meant by that. And I think sometimes I feel that it's whoever they happen to meet at that time that they were ready for change is the way that then it sort of folds out, and that determines the next few stages.
Yeah, when I work with people, I try and encourage them to get very much in touch with their own intuition so they can have a sense of what it is that they need to do and follow, because you can't obviously do everything that's on offer really, and getting in touch with that seems to access that portal really.
Absolutely, and I think sometimes helping people to come back to the joy in their lives gives them an important clue as to which way they might need to go. And sometimes it comes out in an image, even that they hadn't got the words for before, or that they haven't experienced or noticed something. We often do a mindful walk in the garden and encourage people to just notice something that grabs their attention, and sometimes that can be a focus for that sort of thing.
Excellent. I think that's very important, because people come in and they can think that they have to do this and they have to do that and they have to do the other, and actually it's about accessing this shift, this almost paradigm shift in consciousness or some relationship that they have to themselves or life that's actually needed, rather than the necessity of doing everything.
And they sometimes have to work that one out themselves as well, because it does seem that you can say that to somebody, but if they feel that the answer's over there somewhere, that they've got to find it, then sometimes it's hard to help them look at the bigger picture. But often then that's what they come around to.
Very complicated and intricate unweaving that has to be done, isn't it?
It's the delight, it's the art of medicine, and it really is that creative art. We talk about the creative arts as if they were something separate, but I think medicine, when practiced sort of at its best, can be a really creative art.
I wanted to get slightly not critical, but interested really. You talk about a whole body response really, and Professor Thomas was talking about all the natural substances that he's proved and considers may be appropriate. I think for me is the body's natural physiological function. My sense is that we have what I call fundamental prerequisites to correct physiological, immunological and endocrinological functioning, which is a lot of long words. But this sense of these fundamental prerequisites, that if they're in place physiologically, supports the correct physiological functioning of the body. And for some reason, in my entire time at medical school, they forgot to cover that subject. And I've been looking at iodine and magnesium and pH and vitamin D and vitamin K and iron and B12, zinc and selenium and krill oil and omega oils. And you start to build up quite a long list of things. How do you work with that aspect of it at Bristol? Because to turn that, which we sort of intuitively agree is perhaps correct, into evidence-based medicine that you can present to people in a way that integrates with the oncology departments, for example. How is that?
It's a good one, and it's not my area of real expertise, and I suspect that it's made more complicated by the normal ranges being so individual in a sense, and we're given a kind of wide-ish normal range, but we know that there are some people who fall outside that, and that's normal for them. So how do you know when to treat and what to treat, and what's the most important thing that then will set everything else correct? Or are you going to intervene upstream when actually, so why would this person be deficient in this? Is it something further downstream that's causing the problem? So I'm not. We don't generally recommend that people go off for detailed nutritional testing, mainly because, as far as I understand it, it's expensive and it's not always completely accurate in terms of what then needs to be done. So we tend to encourage people to sort of shore up their bases by using variety, colour, moderation, and cutting out some of the things that we know really stress the system, whether that's a physical, emotional, or sort of psychological stress of the system, or whether it's a toxin that they're ingesting or exposed to. So it's an interesting one, and I think that again it comes back down to the individuality of people, that some people seem to be able to tolerate quite high levels of disturbance at one level and still be healthy, whereas a small level of disturbance in another of their domains then rocks the whole system. So I'm fascinated by building people's resilience, and I do think that being resilient in a number of areas then can kind of compensate for some deficiencies in other areas. I don't know whether you'd agree with that.
Yes, I think that's so. The body is very adaptable, really.
And it's a constant.
Yeah. But for me, there are fundamental deficiencies. Iodine, the World Health Organization iodine deficiency report categorically states 95% of people in the Western world are iodine deficient compared with the Japanese. We don't offer that to pregnant mothers. We know that iodine deficiency causes cretinism, mental retardation, and we know our levels are 50 times lower than the Japanese, but we don't do anything about it. Why is that?
Do we have sort of 50 times the incidence of those problems that they do?
Half the incidence of breast cancer, they have half our neonatal mortality rate, which is an index of the health of the nation, not just...
But cretinism, or do you think...
Much less. They have a 5-point higher IQ on average. So, but iodine is what the thyroid uses to make thyroid hormone out of. You can't make it out of anything else. The thyroid is the engine of our immune system, and we're deficient in its major fuel.
Well, it is interesting, isn't it? Because the response to the vitamin D sort of epidemic, or vitamin D deficiency epidemic, is very interesting, with PCTs telling GPs not to retest, and wondering whether to redefine what's normal, the normal levels and things. So I think we are, we like fancier, higher tech answers to things and interventions as doctors. Do you think we're seduced by the science? I don't know. Why is it that we don't cover the basics? And I think my beef is just how little we're taught about nutrition, full stop, and it's only in terms of biochemical pathways and nothing practical. Even now, 30 years after I've finished medical school, it's still exactly the same. That actually it's all macronutrient focused, not much micronutrient learning, and it's complex. No doubt about it. It's hard to draw very black and white answers with it. I think that the healthy eating guidelines that we generally promote tend to be a kind of alkalinizing diet, and that the things that we generally say eat in moderation tend to be the sorts of things that are more acid forming foods. So I personally don't feel that for most people who are happy to eat well and support themselves in other ways, that it's necessary to add extra bicarbonate, but we certainly would be helping them move towards a more plant-based whole food. We don't do any tests, and we don't prescribe any medicines at Penny Brown, more because we see ourselves as the kind of bringer together of approaches. So we might help people interpret test results if they come to us with a test result that they're confused by, whether that's a conventional test or something that they've organised themselves. We're not set up to collect any sort of physical samples, which is interesting. We're thinking about doing some more basic science research in collaboration with the University of Bristol, and it might be that we do end up, helping track people's urinary prostaglandins or cortisol responses or something like that. So that will be something new for us, but we don't use personally any biochemical measures as an indicator of sort of well-being or progress. We will generally encourage people to go and have their vitamin vitamin D levels checked by
Okay.
their GP,
Yeah.
and then enter into some correspondence with the GP if we feel that they're not being replaced as indicated by the test.